We are live. How are you guys doing tonight?
Hi.
Doing great. Hello.
Good evening.
First of all, I want to thank each and every one of you for agreeing to do this, to talk to the community. Not only just talk to the community, just talk to people in general about about the health disparities that are going on in the African American community, but also about the health disparity that's going around with COVID and the different myths. So what I'd like to do is go from top to bottom. Dr. Martin, will you please introduce yourself?
Hi, everyone. My name is Dr. Giselle Martin. I am the CEO of the Dr. Giselle Martin's Enterprises, as well as the Heal the Public Collaborative. And so through that, we have a podcast called Crucial Conversations that we talk about different things that plague the Black community and how we can heal the Black community. And it's not just for Black people, it's for all of us. And so we are really addressing health disparities from a systemic level, which has been causing issues for years, hundreds of years here in this country. So I am happy to be a part of the group today. Thank you.
Dr. Williams?
Hi, my name is Dr. Rochelle Williams. I'm in a private solo practice in the Houston metropolitan area. I practice at several skilled nursing facilities, LTACs, and hospitals. I'm a native New Orleanian, and I'm happy to be here to talk about disparities in medicine and specifically COVID.
And our local health practitioner.
Hi, everyone. My name is Shinyeri Eze. I am a CEO and medical practitioner of Eze Health Center. We're located in Waldorf, Charles County, Maryland. I provide services in primary care, medical weight loss, and holistic health. I'm especially, passionate about addressing issues regarding racial disparities in healthcare. So, Deron, I want to thank you again for bringing me on tonight.
And for my pharmacist, my friend, my local pharmacist.
Thank you, Duran. Hello, Charles County. My name is Deepan Patel. I am a first-generation immigrant from India. I'm practicing my community pharmacy here in Charles County, predominantly serving African-American clientele, but there's no limitation on who can take an advantage of the services we have here. We established since 2015, and we are trying to break the conventional approach of the pharmacy and experimenting on different ways how we can achieve the best output from all the work that our medical providers do in prescribing the best regimens for our patients. And we're just trying to ensure that, that effort, we take it to the next level for our patients. And thank you, Duran. I'm honored to be here.
Again, I want to thank all of you for taking time out of your busy schedule to come in live with us to just discuss some things. I found we're going to talk about, first thing, we're going to talk about myths, dispel the myths and false information about COVID and the COVID-19 vaccine. And I want to lead off, you see a lot of conversation. I'm going to direct this question to Dr. Williams first. You see a lot of misinformation. Folks want to talk about the Tuskegee experiment. And, just doing my research and, knowing what I know, that was over 40 years ago. It started in 1937 and it ended in 1972. However, our president, Bill Clinton, he followed up with an apology to the African-American community for what it did. But it goes back before the health disparity, before the Tuskegee. But one thing I did find out that I noticed, and I did a YouTube of President Clinton speech. He did apologize, and it was very graciously. However, when doing that, it wasn't backed up with policy. And the only way we're going to escape this, you have to back it up with policy. You had 2 presidents later, actually 3, President Obama, with the legislation of the affordable health care, tried to tackle that, I call it that 10-pound gorilla. And as you know, right now, the Republican Party has been at every opportunity they get to try to dismantle it. And so we want to talk about the institutional side, of this disparity as far as health in our community. So Dr. Williams, would you please speak on that?
Sure. I think it's a twofold issue. Part of it is a lack of trust amongst the African American community and medicine and science. I think the Tuskegee experiment is part of it. The other, I think, is there's a huge disparity in medicine in the treatment that a Caucasian patient with the same diagnosis and an African American patient might get. In terms of workup, I've experienced it personally in my family just recently with my father having COVID and talking with his physician, asking, are you going to repeat his chest x-ray? And being told, oh no, that exposes him to too much radiation. Well, clearly that's not the standard of care right now for COVID. I see it in patients being a physical medicine and rehab doctor. Often African American patients are stereotyped to be drug seeking. I've had a patient just recently within the last couple of weeks who had severe hip pain. The nurses didn't want to give him the medicines as ordered on the MAR, saying, oh, that's too much. And the therapists are like, oh, he constantly complains of pain. And subsequently, we did an x-ray and an MRI. He had an abscess in the hip and a fracture. But none of the doctors prior to me decided to work it up. And unfortunately, that happens all too often. So I think it's a twofold lack of trust. And then the same care is not given to all patients, unfortunately. It's the sad reality of living in America.
Wow. Anyone else want to expand on that as well?
Yeah, so, as a medical provider, it's definitely something that disturbs me within, the healthcare community, is that we do have these wide disparities among African Americans and other races. And a lot of times it's institutionalized. There's, a lack of access, a lack of resources within the African American community. And in addition to that, there's other things like implicit bias, like the doctor just mentioned. Unfortunately, when you have a person, a healthcare provider, who is seeing one patient differently from another patient based simply on their race and not on the presenting symptoms or the signs or whatever their diagnostic workup is, then it's problematic. It is going to lead to further disparities in care. And what we're seeing now, it's been institutionalized, and now we are seeing how that translates into the higher levels of COVID-19 amongst the African American community, and also the percentage and rates and percentage of vaccinations within the African American community versus the white community. So it is something that we need to address. It's been a long time coming, and unfortunately, the elements of the past that has led to a lot of African Americans feeling that that we cannot trust the system. It's something that we need to make a change on, for sure.
I'm gonna, Dr. Martin, hold that. I have something I want to throw in with you, Deepak. In reference to, can you talk about the value of the information as far as regarding the distribution of the vaccine?
I'm sorry.
Can you talk about the valuable information as far as the public, as far as distribution of the and administration of the vaccine, safety piece of it?
For the COVID-19 vaccine, or generally overall all the vaccines?
COVID-19.
Okay. So COVID-19, there are multi-front approach in terms of distribution. Unfortunately, the production hasn't been at par to be able to distribute as desired levels. But we have currently 2 vaccines in the market. One is by Pfizer, the other is by Moderna, and they both are about 95% effective with minimal side effects. The common side effects that most people experience are what you consider as flu-like symptoms. Headache, chills, body ache, fever, soreness of the arm. They typically go away in a day or 2 at the most. Severe side effects, if you're considering the safety part, the only people who are currently not advised to take the vaccine if they ever had any anaphylactic shock, which is a severe allergic reaction to the vaccine of any form. And if they are allergic to polyethylene, glycol, or polysorbate, which are the component of the vaccines. If they, on the other side, if they have any, if they are on any immunosuppressant drugs, or if they have any medical condition that prohibit from taking the vaccine, or they need to be assessed on case-to-case basis. But at any given point in time, you're better off with your chances with vaccine than not without vaccine.
I'm on social media a lot, and I heard someone said, well, the J&J, and I used to work for J&J, the J&J vaccine said, well, why would I want to take the J&J vaccine? They call that the Pinto version for you millennials. That's an old car versus the Mercedes version with the Pfizer and the Moderna. And I almost about fell out of my chair because we know that the J&J vaccine is a 1 dose and the other 2 are 2 doses. What are your thoughts about that?
So the best vaccine you can get is the first one you can get.
Thank you.
So you don't really want to wait.
I'm not a health professional. I responded word for word what you just said.
Yes, the best vaccine is the first one you can get in your arm. You don't want to wait for the, what you consider is the best vaccine and wait for it and, go without the immunity that you can get from the very first dose of the vaccine.
All right, this next question is going to be for Dr. Martin. It's in reference to wellness and this whole health disparity and the whole COVID, and not only just COVID, but wellness, period, taking care of bodies.
You're saying how?
Health wellness, I'm sorry.
Can you rephrase the question, please?
Health wellness. What are your thoughts as far as health wellness of taking care of your bodies, your immune system, in reference to, if you don't have COVID, different things that you can do to, just get your body, your mind together?
Oh, there's tons of stuff. I mean, obviously there's mindset and all of these other things that your wellness gurus give you out there. But my primary thing with people is our nutrition. There's so much that we can do to protect ourselves by watching what we eat. And I know a lot of people are at home and eating all kinds of things that maybe they might not necessarily usually eat if they were going to work every day or on their normal fitness regimen because they're going to the gym and all of those things. But what I do want to say is that, a lot of our immune system is in our gut lining, and that is most directly impacted by what we're eating every day. So eating foods that are very fibrous, that have a lot of phytonutrients in them, those types of things are going to be the most protective from a nutritional standpoint. Obviously, moving, getting fresh air, getting enough vitamin D. Vitamin D is actually very beneficial for your immune system as well. And so there are so many natural things that we can do from a wellness perspective that will also help improve or make us less susceptible for COVID as well.
Great. Dr. Williams, I have a question from the tab, and actually it's almost the same question that I have here. Will the COVID vaccine prevent a person from getting COVID infection?
It doesn't prevent you from getting the infection, nor does it prevent you from transmitting it to someone else. The thought process with the first vaccine, it's 50% less sick than you would be without it. And with the second vaccine, it's in the 90s, some studies high 90s, some studies low 90s, as to less of an effect if you were to get COVID. So I myself am fully vaccinated at this point. If I go out and I'm reckless, I don't mask, I get COVID, I would still get it, but it would have substantially less of an effect than it would if I were unvaccinated. And being vaccinated, I can still give the virus to someone else. So you still have to be cautious, social distance, mask, proper PPE equipment.
Just to add it to Dr. Williams' response, vaccines, they don't prevent any medical condition or any infection to occur. It, in most cases, prevents you from dying of that condition or infection, because it gets your body ready to fight back in the event of an infection, and that's the sole purpose of vaccination.
I think the perfect analogy would be the flu, as a lot of people are more familiar with that. If you get the flu vaccine, you potentially during that flu season can still get the flu, but you'll be much, much less sicker than you would have been had you not been vaccinated.
Yeah, and it's I know one thing that a lot of individuals have been concerned about with this particular vaccine is that it's utilizing a relatively new technology called the mRNA, or it's an mRNA vaccine. So essentially, this is a technology. It's relatively new in regards to implementation is used as a vaccine, but it's decades in the making. The research has been out there, and it's been shown that this is an effective and safe vaccine. One way that I like to describe it, I was able to describe it to my daughter, who's 8, so she kind of understands how vaccines work. And this one in particular is that the mRNA vaccine kind of shows your body a picture of what the actual COVID-19 virus looks like. So it lets your body see it, recognize it, and know that once you are in contact with the virus, your body recognizes it, sees it as an enemy, and can more rapidly produce an immune response against it. So that's essentially how this vaccine works. And yes, there's going to be certain side effects that come along with it. That's kind of expected. A vaccine by its pure nature is supposed to cause an immune response. It's preparing your body to fight against this pathogen or disease-causing entity. So when you have, a mild fever or chills, this is simply an immune response. It's not something that's considered an adverse effect or a bad effect. It's simply kind of showing you that your immune system is working, and that in fact your immune system will respond accordingly or appropriately when you're exposed to the virus. So it's really important that people understand that these mild side effects are not necessarily a bad thing when it comes to receiving the virus.
It's funny that you should say that. As a joke, I told someone the other day, I'm going to claim it. I'm a lot older than you guys on here on this call, and I said I remember going to the club and washing my hands in the restroom, and that little thing that go round and around to dry my hands on. And I said, if I survive that, I'll survive the COVID vaccine, because you think about it, that little towel used to go round and round, and you don't know who. Everybody in the club, at least in the men's room, had their hands on that little towel. So you'll survive. I have a quick question from the audience. Can any doctor follow up on an impact, any known of the vaccine in the individual who has had an impulse? What is called IMMUNODEF?
Immunodeficient.
Yeah.
Immunodeficiency. Okay.
Anyone wants to
So,
take a
so what's the question, just so that we're clear?
Can any
Someone
doctor,
who
go ahead.
I'll let you go. I'm sorry.
Can any doctor follow up on the impact, any known of the vaccine in the individual who's had that big word, that big I word?
Deficiency.
Well,
Who's
someone with
immunodeficient.
an immune deficiency would definitely want to be vaccinated. I think the order that the CDC put out were healthcare providers, so any medical provider, any janitor working in a hospital, etc. And then the second group of people were the senior citizens and immunocompromised people. So their ability to form an immune response is less. As she was saying, and with the vaccine, your body is forming antibodies to the vaccine so that when it's actually exposed, it's not the initial response for that person. So they should be running to get any vaccine they could. I joked with people that at this point I would take the vaccine in my eye if I could. Like I was just waiting for my turn. But somebody who's immunodeficient, they definitely want to try to get the vaccine as soon as possible.
All right. Here's another question. Is it safe for women to get a COVID-19 vaccine if they would like to get pregnant someday?
So absolutely, it is safe for women who are wanting to get pregnant at some point. It is not something that's going to impact fertility. I know there's been this concern about a woman becoming sterile from the vaccine, and it's just simply not true. There's no evidence or research that states that there's any correlation between fertility and getting the vaccine.
If a person has already had COVID-19 infection and is recovered, does he or she still need to get vaccinated with the COVID-19 vaccine?
Yes.
Absolutely. Yes.
Because as you see, people who may have had COVID infection, you can also you also see the cases of reinfection. So having an infection and recovering from that infection, that gets your body, that gets some antibodies to you, but we don't know how long that natural immunity is going to last. So, having an infection of COVID and recovered from that, it's not an alternate for getting vaccine.
What about seizures?
Does the vaccine predispose you to seizures?
Yes.
Or
Yes.
there have been a few people in the country who've had a negative reaction to the vaccine. Overall, it's very minimal numbers. I think the allergic reaction has been the most common, which everybody's sort of heard about. I myself have several allergies to many things. When I went to get my vaccine, I bought my EpiPen with me just in case. But I don't think anybody should not get the vaccine unless it's a specific allergy to vaccines.
Yeah, and I would add also.
Are patients unable to get the flu shot? Can they get the COVID vaccination?
I think it depends on what aspect of the flu
Yes.
vaccine.
Some of the flu vaccines, the patients, they are not able to get because of the components of egg that is in the flu vaccine. However, the currently available COVID vaccines, they're free from eggs. So if somebody is allergic to egg or egg component, and that is the reason for them to not take the flu vaccine or not being able to take the flu vaccine, that concern, checks out here. You don't really have to worry about that. But again, it's an individual assessment on, what is the reason for their not being able to take the flu vaccine.
I know, Deepan, I know there's been talk, this big, huge talk about the CVSs and the Walgreens that are going to be giving the vaccine to individuals in the community. What about smaller pharmacies like you, independent owned? Like you?
Yes, thank you for bringing that up.
Can you speak up a little bit?
Yes, thank you for bringing that up. So, federal government, they have partnered with retail pharmacies under Federal Retail Pharmacy Partnership Program, where the vaccines will be distributed directly from the federal government to the pharmacies participating in that program, so that they can get that out to maximum number of people as fast as we can. Independent pharmacies, along with the CVS, Walgreens, and other bigger brands, part of this partnership. So we are just waiting for the allocation to start. Actually, the soft it has started. The pilot. I think they started the pilot project with some pharmacies, and they are going to expand it out to all the participating pharmacies. Unfortunately, we don't have the exact date, but when we get the date, you'll definitely hear from us.
All right, you hear that, Charles County? You will be able to get your vaccine, your vaccination at High Street Pharmacy. And he has 2 locations. One is in Waldorf, and the other one is in the Bryan Road area. Yes, so you can calm down. You'll be able, I understand you want to go to CVS, the big boys at Walgreens, but just as a shameless plug, High Street Pharmacy is my pharmacy. And I love him. I can go in there, ask questions. He'll stick his head out through the window, tell me a joke or two. I'll yell a joke back. But, you're in good hands in the Charles County community. I just want you guys to know the big guys that you see on the corner, if that's what you want to do, great. But we have a small independent owner here in the community that is not only going to provide you with to get the vaccine, but here's another shameless plug. This gentleman has the ability for the older people that don't have a ride, he'll have your medicine delivered to you to your front door.
So that's another thing. What we are working on logistics of actually vaccinating people if they don't have transportation, on how we can get the vaccine out to them. We are figuring out the ways if we can have one location convenient to people if they are out away from pharmacy, or which is going to be an off-site vaccination, or we can, as we deliver prescription, if we can figure out if we can do the home vaccination. So there are some obstacles, we just need to overcome them, but we're working on it. Hopefully we can get that done so we can get it out to every individual, regardless their ability to come to pharmacy or not.
Dr. Martin, in the Houston area, have you been vaccinated yet, or are you? I know it's have you? What are folks are going through in your community?
Well, I am in Dallas. Actually.
I'm sorry, Dallas. I'm sorry. Can you speak up a little bit?
Yes. Can you hear me clearly?
I can hear you.
Okay. Yeah, I'm in Dallas right now, and so I know that they are rolling things out. Every state is kind of on a different timeline. So they are in phase 3, I believe. So we're starting to send it out to people who are 65, and I think it's 60 to 65. They started at 75, and all of our first frontline workers. I have not been vaccinated yet because I'm working from home. So if I were in the actual office and front facing with our patients, then I would have gotten vaccinated. But I'm not considered first level at this point. And I still work in DC, even though I am quarantining in Texas. So,
Dr. Williams, I know you have a practice in Houston. You're in New Orleans right now, and Dr. Williams and I, we're personal friends. You went back to Houston to get, where your practice is, and I know you're in New Orleans taking care of your dad. As far as getting the vaccine in the Houston area, are you having the same problems? Because I know here in Maryland, folks are complaining that, they can't get it fast enough. And as we know, surprisingly, West Virginia is leading the nation.
I
vaccinated.
Yeah,
I think for the people who want it, it's never fast enough. So prior to my getting it, which I think I got the first vaccine week 3, I had colleagues who were critical care or infectious disease or trauma surgeons that got it the first week. And I'm sitting there like, oh, I want it. But realistically, in the grand scheme of things, they should have been before me. So I think the order that we have, it's just moving slow. From an operational point of view, you look at countries like Israel, we're still vaccinating frontline workers and they're already on the elderly. They've already finished most of the country. So in that sense, it's frustrating. But I think the order that things kind of flow, I put myself week 1 on about 6 different lists. Different facilities emailed me because my practice is all inpatient based. And I signed up on all the waiting lists, and the first waiting list that called me, I went. I was in New Orleans when it was time for my second shot, and I could have gotten it here, but I know there's this huge unspoken debate about people from one state using vaccines in another state. And, I could have easily gotten it here. I felt a little weird doing that. And then there wasn't really clarity as to if different places in New Orleans were going to give me Moderna or Pfizer. And for me, it was already the second shot. So I didn't want to do anything to mess it up or waste vaccine from other people.
Truth be told, Dr. Williams, you were worried about being shamed by me if you would have the medicine in New Orleans. I give her a hard time, y'all. Just for the folks that are listening, someone asked, the information related to vaccine in Maryland is posted at covidlink.maryland.gov. Again, for information related to vaccines in Maryland, it's posted at COVID, that's COVID link, one word, .maryland.gov. So you can go there and get all the information that you want, and you can. I know correct me if I'm wrong, in Houston or in Dallas, do they have mass vaccination sites? What I mean by that, these stadiums, are they doing that in the Dallas area and in the Houston area as well?
Yes, they have recently just set up the Cowboy Stadium as a mass vaccination site as of 2 days ago, I believe. So if you go by there now, you'll see all these trucks with vaccines and all kinds of things. They're setting up stations so that people can come in quickly and get their vaccines and be on their way. So I'm curious to see how that goes.
I know here in the Charles County area, we in southern Maryland. Some folks want to say we off the grid, and we are in a way. The 2 mass vaccination sites are in Prince George County, with the large population, and then they have another one in Baltimore. I could be, I know one is in Baltimore. I think that's the only 2. I could be wrong. Jennifer Long, if you're listening, please correct me in the chat. But I do know it's needed here in the Charles County because we are a community. Some want to say we rule, but we don't have any public transportation, and for people to get there, and that's a problem when we talk about health disparities, especially in the African American community. In DC, a lot of folks. Well, DC is kind of changing, but a lot of folks still rely on public transportation. What do you think, DPAP and Ms. Ernie, that we can do for a child in Charles County to better serve our residents if we had something like that?
Yeah, so in regards to the logistics of the vaccine distribution, the unfortunate part about how it even started is we got the vaccine approved, great. We've got the supply from the companies, great. But unfortunately, there was not a plan for logistics on distribution and administration. So now it's almost like we're trying to fly the plane while we're building it, right? Trying to get the vaccine out to the most vulnerable individuals. Here in particular in Charles County, I myself have had a good experience with their vaccine distribution. I went through the health department. As a healthcare provider, I was in one of those early categories to get the vaccine. And it was a fairly simple process. You go online, you can either pre-register to get on the list, and they would call you once it's available. You go through, it's actually a drive-through site. You sign up for a time, you go through a drive-through site, and you get your vaccine. They are very methodical, very organized, and I had a great experience. I actually got my second vaccine shot today. So as far as ways that things can be improved in Charles County is literally just getting the word out. I think the Charles County Health Department is doing a phenomenal job considering the limiting resources, and also keeping in mind they only get a certain number of vials a day coming in. So it's really important that people remain patient, register. You can pre-register. I know once they do expand it to allowing, independent pharmacies, and hopefully over time, even, healthcare facilities like as a health center that I have, to where we can provide vaccines for more in the population who want to get it.
Just an FYI for the folks that are listening, the Maryland Healthcare, am I echoing? It is a state-run agency. The county commissioners, the county government has nothing to do with it. And I think folks, the misconception that folks think that county government is running a health department. Charles County, just like the other 23 counties, and also Baltimore is Baltimore City, all the health departments are under the umbrella of the governor, who has a health officer, and each county has a health officer. So I want everyone to know, here, especially here in Charles County Matters, folks saying, well, the commissioners need to do this, the commissioners need to do that. The commissioners have zero control. Matter of fact, I do know there's two, that hasn't even had the vaccine. And I would think, if they had an opportunity to get it, they would have gotten it. I do know I saw photos of Sheriff Berry. He got it, and he's a first responder. And he's the sheriff, like the sheriff here. And I do know that the school board the vaccines are being released to the teachers, because from what I understand now, they're going to open back schools on March the 22nd here. And the teachers, I may be wrong with the date, but I know the teachers are going back February the 22nd, but the students are going back in March. So I want to talk about this here. There's a misconception about kids. And what is the youngest age that a child can get the vaccine? You want to take that off? Take that down?
It's 16 at the moment.
Years as of now.
Okay. There's this other thing I saw today about double masking. What are your takes on that? I mean, I went out today and to the store. I saw that on television, and I actually went to the CDC website because it was on the morning show, and it said, at least if you can wear one mask, wear one mask. But if you can wear two, wear two.
I've been double masking since March, since it started. If I have an N95 on, I cover it with another mask just because I've been reusing the N95. If I have on a non-medical mask, I double mask. I've done it since the beginning, so I can't really comment on that.
I'm gonna put my mask on for you for a second, for a practical demonstration. Do you wear a mask like this?
No.
Do you wear a mask like this?
Yes, that's good.
Put
Pinch
your
it around the
glasses on
nose.
top of, yes.
It's better.
If your glasses fog up, what does that mean?
That there's air going through.
So
Yeah.
when you put your mask on, this little thing right here is a piece of little, whatever it is in here, you should take it and contour it towards your face. Would that be correct?
Yes.
I tell you what, I'm like everyone else. I am masked out, and I got 3 boxes of masks, but when I do go out, I do wear my mask, and I see folks wearing their masks like this here, and I'm kind of like, well,
Yeah,
you're still breathing in
yeah,
germs.
it doesn't serve the purpose.
It doesn't
I
serve the
think
purpose.
I think the best analogy is a lot of people know how to correctly use condoms, but they still do it incorrectly. So it's an opportunity.
I did not say that.
I mean, at this point, we're almost into a year of this. So I don't buy that people don't know how to wear them. I don't buy that it's a political issue. I've had people that are, very strong advocates of President Trump, and they are like, oh, Fauci's a liar. Science doesn't lie.
Right.
Whether you're Republican or Democrat, wear a mask. It's easier than putting on a condom mask. So I think people are just lazy and reckless, and it's unfortunate, but mask over your nose, over your mouth. The new variants are more contagious. There are people who know that they're contagious and still expose other people. It's just sad.
Yeah, I almost had a situation like that, and I thought I was going to go to jail behind it because I was very angry with the individual that I found out later on was infected. It was just awful. Matter of fact, I myself and about 7 other people were in a patient first, all lined up together to get tested. Thank God none of us tested positive, but some people are reckless, so I understand.
Yeah.
I have a question. What percentage of the population wants to take this? What percentage of the population needs to get vaccinated to get herd immunity?
We don't have an exact percentage. The CDC doesn't either, but it's in general thought to be the majority of the population. Some people have loosely thrown around 70%, 75%. We don't have a specific percentage. It's just the majority of the population. If anybody wants to add to that, feel free.
So here's the thing.
That number actually changes vaccine to vaccine. So, it's not one answer that fits all the questions. Each vaccine that has a different percentage, that is, percentage of population is required to acquire herd immunity.
Yeah. So one thing that people really need to understand is that the vaccine is quite literally our key to getting out of this pandemic. For us to rely solely on natural immunity to achieve herd immunity, which means more people getting exposed to the virus and then developing their own antibodies or developing their immune system to fight it, it will take several years for us to get out of this pandemic. The vaccine allows this process of quote unquote herd immunity to hopefully happen a lot sooner than naturally allowing large segments of the population to actually get infected. Also, that approach would increase mortality and the number of deaths. We're already seeing extremely high numbers of individuals dying in hospitals, dying alone in hospitals because of this condition. So I think if people really embrace the idea that vaccines are really the key to getting out of this pandemic sooner, then hopefully more people will embrace the idea of actually getting it. and letting their friends know to get it too.
What about if I have allergies? Is it safe to get the vaccine if I have allergies?
Yeah.
So I think we addressed the question earlier. So yes, if you have allergies, you most certainly can get the vaccine. I know certainly we talked earlier about immunocompromised individuals and how it's important for them to also get vaccinated. And I know Dr. Martin wanted to kind of mention a little bit about that immunocompromised.
Yeah, thank you so much, Shingeri.
Can you speak up a little bit, Dr. Martin?
Yes, for people who have even a severe allergic reaction to food or medication, it is definitely okay for them to receive the vaccine as long as they're not contraindicated by something else that's pertaining to the vaccine. And for people who are concerned about a medical allergic reaction, anything like that, it's okay. Most clinics are actually allowing people to stay in the clinic for up to 30 minutes after the shot is administered, just in case they do have some type of allergic reaction as well. They have EpiPens on hand. You can bring your own EpiPen. So they have really thought through this. And so I don't want anyone out there to feel like, you know what, I'm allergic to pineapples, I can't go get this vaccine. That's not the case.
Yeah, actually, CDC guideline is mandating to observe the recipient of the vaccine for at least 15 minutes. If the individual has any, if they are immunocompromised, or if they had any syncope in the past, or if they are allergic, they have any allergies, then in that case, they are the vaccine providers. They are required to observe them for at least 30 minutes.
Same
I
thing.
want to go back to health disparities. This nasty monster disease, whatever you want to call it, 10-pound gorilla. I know for me it's personal. It has affected my family. I lost, get a little teary-eyed, excuse me. And I lost 3 good friends that are no longer here. Each one of them, they had some other issues. One was dealing with high blood pressure, and the other 2, diabetes. We know diabetes, and I did some research. It is common in 10% of African Americans ages 35 to 49, compared to 6% that are of Caucasian. Why is that?
Well, so it's personal for me too. I just want to share that. And as of January, I believe it was January 5th of last month, more than 1 in every 750 people who are Black or African American in the United States have died from COVID. So for people who minimize the significance of this, it's really dangerous because Black Americans are dying at a higher mortality rate than any other group in this country, except for Indigenous Americans. And that goes back years as to why these disparities exist. I'm not really going to go into that right now, but Black people are more likely to have comorbidities and are more likely to also be frontline workers. They typically have less access to care. They have less access to timely care as well. And so that's why it's so important for people to understand the nuances of what is misinformation out there and what is actual real information, so that way they can be equipped and we can help reverse these statistics, because it is very alarming.
I read something today that physicians can also work to eliminate the racial and ethnic healthcare disparities by encouraging diversity within the profession, continue to investigate healthcare disparities by supporting the development of appropriate quality measures. Dr. Williams, you want to talk about that? I got that from the CDC website.
I think it's much deeper than that. That would be like saying we're going to solve the Black Lives Matter movement with only other Blacks. It's a much deeper issue than that. I think having more people enter the profession is great by all means, but I don't think that's going to solve the issue. I think it has to be an awakening and a lifting of social consciousness. Unfortunately, the political climate of the country right now, it's probably more racist than ever. So I think it's a much deeper issue than just getting more people of color into medicine, unfortunately.
I agree.
Well,
I believe it's more of a it's omitted cultural consideration and lack of cultural representation. Yes, but it's also very policy driven. Like a lot of our policies need to change. Many of them were derived during a time when our country was, in fact, very racist. I'm actually a professor of health policy at GW, and I teach this stuff. We have got to go back to the drawing board with how our entire healthcare system is set up in some ways, how the care is distributed throughout the community, how our medical schools are being taught. We do not consider these cultural nuances in the way that our clinicians are being trained. And so, to everyone's point here, it's so much deeper than just Black people caring about Black lives. This is something that impacts all of us, whether directly or indirectly, because guess what? If the death toll rises, our taxes are going to go up. We are all affected by this in some form or fashion, whether it's your taxes, whether it's the risk pooling for your health insurance, whatever it is. But it's a very, very policy related issue. It's very, very deep.
well, we got 10 minutes left, and I said I was going to keep this to an hour. I'm going to, for the folk that are listening, again, I want to thank you guys for coming. I have some more questions, but this will probably be a part 2 in 2 weeks, so I'm going to bug you again. I apologize.
Anytime.
But I want the folks to know that I purposely, and Deepak, he's a friend of mine, I want to thank these 3 strong African-American women for coming on here. And I think it's important for our young girls, our young daughters to see young women, yes, you too, Dr. Williams, young women in the medical profession.
Clara says I'm young, okay?
I told you guys, I was going to pick on that have some letters behind their names. And Deepan, you being a pharmacist, I think it's great to see minorities, not only of African Americans, but also of, I think you're from India, am I correct?
Yes.
Folks to see you in the profession as well. And it's important. So we're going to close out. Dr. Martin, I want to hear from you. If there's anything that you wanted to tell the community before we close out.
Well, you guys, I just want everyone to be healthy. I want you to be safe. Do everything that's within your power to keep yourself healthy, whether it's wearing your PPE, whether it is keeping your home safe. Please, by all means, wash your hands. But take care of yourself, mind, body, and soul. Eat well, pray, relax. All of those things are also very important. Maintaining your stress is also going to help keep your immune system in tip-top shape.
Dr. Williams?
Vaccinate as soon as you have the opportunity. Once a vial is open, it's only good for so long. So most places that are vaccinating, regardless of what phase they're on, there's a backup list that you can get on. A lot of people don't know that. So that if somebody who is scheduled, whether it's the senior population or doctors they're on, and they don't show up, they go to that backup list so that vaccines are not wasted. And wear your mask and social distance. We're in this together.
Ms. Izzy?
Yeah, so definitely getting out there, that is very important that we all get on board with vaccination. Listen to health professionals, listen to reliable resources, the CDC, your state health department. I know for Charles County, Well, actually, I'd like to mention the state of Maryland, I think, that does a wonderful job in providing online resources. I know earlier, Duran, you mentioned the COVID link. So I just wanted to repeat the website here. So that's COVID link, covidlink.maryland.gov to get more information statewide about the COVID vaccine and testing and everything. More specifically in Charles County, you can go to their website, charlescountyhealth.org. On that website is where you can register or pre-register to get your vaccine. Even if you get your vaccine, mask, social distance, sanitize, wash your hands, you still need to do these things. By no means is it kind of a free-for-all if you get the 2 doses of your vaccine and you can just do any and everything right. Yep, keep the hand sanitizer when you have it. So it's just very important that people understand that, don't believe all the myths, don't believe all the misconceptions, don't give into the fears about it, because honestly, it's a lot more scary actually contracting the COVID-19 vaccine versus, contracting the COVID-19 disease versus, a little rash that you'll get from a shot. So certainly, pay attention and read the right resources. Trust your doctors.
Deepan?
Yes, so just to add to all the advices from the years of medical experience we have here, do not hold yourself back if you do not have health coverage. COVID vaccine is not going to cost anybody anything. It's funded by US government taxpayers. So if you don't have insurance, that is not a reason for you not to register or pre-register for vaccination. And there's never, you can never be too protected. So don't drop your guard. Even after you get vaccination, keep practicing, social distancing, mask, sanitizing practices. And importantly, when you go for vaccine, don't be an onion. Don't take layers off and off and off. Dress in a way that it's easy for people who are vaccinating to administer the vaccine.
Well, I'm going to say this here to everyone that's listening, wherever this go, push back away from social media. And if you're going to go to social media, go to Google, go to the CDC website, and read your information from there. Do not get your information from Joe's Crab House or Susie whatever. Those folks haven't been to school. They don't have any letters behind their name. You want to deal with people who have going to give you sound medical advice. When I'm sick, I go to the doctor. When I'm having some issues with needing to talk to someone, I talk to my therapist. Yes, I see a therapist every month, and I talk about that on social media. It's nothing wrong with getting help. It's always good to talk through some things. As I had a conversation with my therapist last week, a lot of folks who we've been in, for me, it will be next in a couple of weeks, because I remember being at Mardi Gras and didn't know I was in a petri dish. That we're going to have to reintroduce ourselves back to society. Yes, we're going to have to do that. We're going to have to learn how to communicate with each other, because we've been stuck in our homes and dealing with our kids. I'm glad I'm not in school right now, because I don't know how those kids are coping, because I am a social butterfly. So I can't imagine. Some kids are great with it, some kids are not. But please, as they said, it's not time to put your guard down. If you get the vaccine, please, still have to wear your mask, social distance. And I know me, sleeves up, buddy, sleeves up. I'm going to get it. I don't care whether it be the Moderna, the Pfizer, or the J&J. Hit me with it. But again, I want to thank you, ladies and gentlemen, for coming on. I'm going to try to do this in another 2 weeks, because I have a lot more questions that I want to get answered. And I think it's good to just get rid of the myth. And an informed person, an informed individual is a far better person than the person that's not informed. And I got that from my mother. She's probably saying, "You go, boy," from her grave. But anyway, again, I want to thank you. Have a good night. God bless. And I love each one of you. There's nothing you can do about it either. Thank you.
Thanks for having us.
Thank
We
you.
appreciate
Thank you very much.
Certainly.
You guys have a good one. Hey, and guess what? It's 7:29. We out of here.
Bye.
Bye.
Hold on one second. Hold on.